Secondary amenorrhea. Secondary amenorrhea is when you've been getting regular periods, but you stop getting your period for at least 3 months, or your period stops for 6 months when they were previously irregular. Common reasons for this type of amenorrhea include pregnancy, lactation, stress, having a chronic illness. How common is amenorrhea? About 1 in 4 women and people assigned female at birth who aren't pregnant, breastfeeding, or going through menopause experience amenorrhea at some point in their lives. Symptoms and causes. What are the symptoms of amenorrhea? The main symptom is the lack of periods. Other symptoms depend on the cause. You may experience hot flashes, nipples leaking milk, vaginal dryness, headaches, vision changes, acne, excess hair growth on your face and body. The different types of amenorrhea have different causes. Some causes happen naturally on their own, while others may be a sign of a medical condition or problem. Natural, or normal, reasons to miss your period include pregnancy, the most common cause of secondary amenorrhea; breastfeeding, or lactation amenorrhea; menopause; having surgery to remove your uterus or ovaries; structural problem with your organs, such as missing parts of your uterus or vagina or having an underdeveloped reproductive system. Common causes of secondary amenorrhea. Secondary amenorrhea is when you miss your period for 3 or more months after previously having a normal period. Common causes include some birth control methods, such as Depo-Provera, intrauterine devices, IUDs, and certain birth control pills; chemotherapy and radiation therapy for cancer; previous uterine surgery with scarring, for example, if you had a dilation and curettage, often called D&C; stress; poor nutrition; weight changes, extreme weight loss or gain; extreme exercise routines; certain medications. The following medical conditions may also cause secondary amenorrhea: primary ovarian insufficiency, PCOS, when your ovaries stop working before age 40; hypothalamic amenorrhea, a condition where amenorrhea occurs due to an issue with your hypothalamus; pituitary disorders, such as a benign pituitary tumor or excessive production of prolactin; hormonal imbalances as a result of conditions like polycystic ovary syndrome, adrenal disorders, or hypothyroidism; ovarian tumors; obesity; ongoing illness or chronic illness, like kidney disease or inflammatory bowel disease. Risk factors for amenorrhea include family history of amenorrhea or early menopause, genetic or chromosomal condition that affects your ovaries or uterus, obesity or being underweight, eating disorder, over-exercising, poor diet, stress, chronic illness. Are there complications of amenorrhea? Amenorrhea isn't life-threatening. However, some causes can lead to long-term complications, so amenorrhea should always be evaluated by a healthcare provider. Having amenorrhea may make you more likely to develop 1. Osteoporosis or cardiovascular disease, due to a lack of estrogen. 2. Difficulties getting pregnant or infertility. 3. Pelvic pain, if structural issues are the cause. Diagnosis and tests. How is amenorrhea diagnosed? Contact a healthcare provider if you miss a period. They'll ask you about your symptoms and medical history, including your menstrual history. Your provider will perform a physical exam and a pelvic exam. How do healthcare providers test for amenorrhea? Your healthcare provider may want to do some tests, including pregnancy test, blood tests to check your hormone levels and detect thyroid or adrenal gland disorders, genetic testing, if you have primary ovarian insufficiency and are younger than 40, MRI, if your provider suspects a problem with your pituitary gland, ultrasound, if your provider suspects an issue with your ovaries or uterus. Management and treatment. How is amenorrhea treated? If your period stopped because of menopause, lactation, or pregnancy, your provider won't need to treat it. In other cases, your treatment will depend on the cause and may include following a diet and exercise plan that help you maintain a weight that's healthy for you, stress management techniques, changing exercise levels, hormonal treatment, medication, as prescribed by your healthcare provider, surgery, in rare cases, In addition, your healthcare provider may recommend some treatments to help with the side effects of amenorrhea. 1. Estrogen therapy to relieve hot flashes and vaginal dryness. 2. Calcium and vitamin D supplements to keep bones strong. 3. Strength training, lifting weights or doing movements to strengthen your muscles. Will I need surgery for amenorrhea? Surgery for amenorrhea is rare. Your healthcare provider may recommend it if you have 1. A physical difference that prevents vaginal bleeding like a vaginal septum or imperforate hymen. 2. Pituitary tumor. 3. Uterine scar tissue. How long does amenorrhea last? Most cases of amenorrhea are treatable. With treatment, your periods should start to happen regularly. It can take a few months for your periods to come back, but in most cases, they will. Talk to your healthcare provider about what you can expect with treatment. Prevention. How can I prevent amenorrhea? Maintaining good overall health can help prevent some causes of secondary amenorrhea. Try to follow a diet and exercise plan that's healthy for you. Be aware of your menstrual cycle, so you'll know if you miss a period. Get regular gynecological appointments, including having a pelvic exam and pap test. Get regular and adequate sleep.